I'm interested in your opinion, actually. Do you see some of the reaction that we're having at the moment in healthcare and particularly mental health, given that's your that's solidly in your wheelhouse? Are we just making some changes at the moment with video and voice instant messaging and some of the remote tools temporarily, or are we going to have a much more enduring transformation as far as modern mental health care is concerned? What are your thoughts?
Oh, well, look, I hope, I'm hopeful that we'll see a sustained move to more innovative digital ways of delivering healthcare. But what I suspect will happen, I think ultimately the government will be watching very closely to see how remote healthcare and telemedicine is working. The key thing, I think, is whether the funders, whether Medicare primarily and private health insurance companies are going to extend the funding arrangements that have been implemented during coronavirus. If the government has the foresight and leadership, I think, I hope they'll do that. And I think that then there will be so many clinicians that think, oh my gosh, this remote telemedicine thing really works for me. It really works for clients. The outcomes are good. It works from a business point of view. And so I think everything is set up and the technology is very mature that it can happen. I think it's going to be a matter of political will. What do you think?
Well, one of the fundamental questions that digital health asks is, how does your healthcare service fit into the lives, the schedules, the goals and aspirations of your client? And I always come back to that. It's almost a principle, when thinking about how we can modernize healthcare, bearing in mind the drivers are coming from the client side. So we as citizens in the community, our lifestyles are evolving, and the cities are becoming more populated. It's not as easy to move around. Taking time out of work in the traditional go to work 9 to 5 kind of model, it's getting harder to actually just do an appointment for healthcare. That's usually not just a 50-minute session. It's transport, it's parking. There's a lot of competition in a person's day in terms of what they're going to use their time for. And I think that's also nuanced by generation and by demographic as well. So I think, the internet is here, it's universal. Smartphones are pretty much owned by everyone. They're definitely at a saturation point in terms of consumption by us all. Internet's everywhere, or if it's not far away from being there. So I think I kind of see it as, yes, I think there's definitely, there's a political aspect to getting the funding right, getting incentives right, getting the policies and procedures right. But I think just as consumers, where in other industries we've become way more used to being able to purchase our goods and services and engage with our goods and service providers online. So I kind of think why should healthcare be any different, or perhaps why should healthcare be not right up at the leading edge, on how to do that? Because it doesn't always have to be one practitioner's time for 1 hour of time, one-to-one with a person. There's other ways that we can use digital tools to scale the individual healthcare provider's time and be able to work with web-based web-based concepts that help clients progress towards their goals, progress towards the type of healthcare outcomes they're looking for, in cooperation with the healthcare provider, but also taking some of the ownership on themselves, whether that's tasks that they perform, things that they engage with, education that they take up. So I see it as being from both sides. I think it's coming from the inside out, but it's also coming from the outside in, and it's just a matter of time. I think if COVID-19 didn't happen, we would be still getting there, but it would just be moving at that sort of pace that it was moving at. but now we have this real acceleration event. But I was curious to see, what you thought about whether it's worth a lot of people's time and effort to kind of, pivot into video and online and use some of these digital health tools, if they're kind of cynical that in 6 months' time, they're just going to snap back into, where they were, kind of 6 months ago. But I think it's a real opportunity to actually just accelerate that transformation and keep going with it, because the tools are just excellent, to be able to continue to work out and innovate the delivery of healthcare.
Well, I think you're right. The tools are absolutely there, and they've been there for probably a few years. Everything's been very workable. Everyone knows how to do a video consult online. It's been interesting just at an individual level in our practice, in our private practice, about half of the people prefer to do it in person still.
Mm-hmm.
And so we're actually open, people can come in, and then half are opting to do it via video. It'll be interesting to see if it's a 50-50 split now in the context of coronavirus. It'll be interesting to see where it's at after coronavirus, and I imagine it'll be maybe 25% would prefer online and maybe 75% still in person, and I think that's interesting. In that online, you get 90% of what you can do 90% of what you usually would online as you would in person, but it's that 10% that we're going to have to be innovative if we want to overcome that 10% that's missing in the online environment. I think that we're yet to see innovations, tools to get us there. I'm sure it'll happen. It's just a matter of all the innovations to come.
Yeah, and I would argue that if you sort of take the COVID-19 factor out of it and sort of say 75-25, it to me that kind of is reminiscent of how all change happens. There's early adopters and kind of innovators by definition within let's say classes of consumers, and that's usually that kind of first 10 to 15% of where the change is being adopted and embraced. And that might, under normal circumstances, persist for a number of years. But at some point, that starts to become the new norm, and it starts to move into a majority, an early majority, and then a late majority, and then that's how most people kind of do things. And it's no longer having to explain to people that, hey, there's this way of doing it, and then there's another way of doing it. It's kind of, this is the new way of doing it, and perhaps there'll be other, early adopters kind of trialing some new stuff, at that point in time. So I think there's a constant evolution towards that, and I think part of the modernization principle is not to go all in unless you really have to, but it's to constantly kind of have that experimental aspect, like an R&D part of what you do, where you're pushing some frontiers. Perhaps 5 or 10% of your business time and effort is going there, which is sort of experimenting with new ways to kind of figure out where a client's going to really value things going forward. And if it doesn't work, discard. If it does work, do more of the same and refine that process and make it better. So yeah, it's I don't see it as being no more in-clinic services from COVID-19 onwards. Absolutely not. But I do think that what will happen, and we've kind of addressed this with our online booking capability as well. We've introduced time zones as an example, because we recognize now that that there will be clients who will only prefer to do it online and not go anywhere. So that means that if you're for argument's sake, a Melbourne-based mental health provider, you could provide services to somebody in the Northern Territory, or in WA, or in far north Queensland, who is that type of client who just wants to do it online, and they have found you and you're available to them because you have that service. So that kind of opens up a growth opportunity. There's an expansion opportunity in doing that. And with that will come data. What was that experience like? Has it been effective? Is it more or less effective? We'll learn from it as an industry together. What are your thoughts around that?
Yeah, I mean, I think Well, I'm certainly an early adopter. Well, I like to think of myself as an early adopter on things. Always buying the latest whiz bang little gizmo and trying to be innovative with business models and so on. I think that the coronavirus has forced people who perhaps aren't early adopters into some of these new ways of doing things, which I think is ultimately going to be really fantastic for them in particular, for their clients, and for the industry as a whole. I think that probably when we look back at the era of coronavirus, we'll see that maybe it's sped up the transition by maybe a year or two, is probably what I'm expecting. We're certainly on the march to, implement more digital tools, and I think it'll just speed it up more.